Dr. Matt here at Plaza Dental. I just wanted to take some time to discuss combating dental anxiety. I know a lot of patients out there have dental anxiety. Studies show that over 60% of the US population experiences some degree of anxiety or fear about going to the dentist. A recent study from the American Dental Association actually estimates that over 2 million dental-related emergency visits occur every year to the emergency room of hospitals. And most of these emergencies could be preventable with regular routine care and checkups. So if there's ways for us to kind of help mitigate that anxiety about coming in, we're really trying to strive to do that. So our solution, we really want to make sure that your fear of the dentist is not preventing you from getting the care you need and deserve. That's why we offer 3 sedation options. One being nitrous oxide or laughing gas, the other one being oral sedation, and the third being IV sedation. So nitrous oxide, aka laughing gas, it's a super extremely safe and effective method for reducing dental anxiety in the chair. It takes the edge off and reduces anxiety within a few minutes of having that nose piece on. I equate it to kind of having a couple drinks. It takes the edge off. You're not going to be knocked out by any means, but you're just going to care a lot less about the work we're doing. I'd recommend this being a good option for routine dental work, such as cleanings, some simple fillings, crowns, bridges, root canals, some simple extractions, or like a single implant. The real big benefit with laughing gas is that you're able to drive home after the treatment. You don't need anyone to bring you. And again, it's just super safe and effective and time tested. The other option we have is oral sedation. All of our doctors here are licensed by the state of Colorado to administer oral sedation in our dental office. What we do is we utilize an anti-anxiety medication called Halcyon. It's also called triazolam. And what we do is when you come in for your dental work, we'll have you come in about an hour before we plan to do any treatment. We administer the pill to you chair side. And again, we give you about an hour or so for it to kick in. What Halcyon does is it makes you very sleepy, and it also has an amnesia effect. So you won't really remember even being here or having the dental work. The one drawback with oral sedation is that you do have to have somebody drive you here and then also drive you home. You won't be safe to drive after being on this medication. So oral sedation is a great option for more complex dental procedures, such as impacted wisdom tooth extraction. Let's say you have a whole bunch of dental treatment and you just want to get it all done at once. It's a great option for that. If you have to have a bunch of teeth extracted, or if we have to place multiple implants, that's really the best use of this form of sedation. From experience, we'd say 99% of patients that have dental anxiety find oral sedation more than enough to overcome their fear. And again, it's been a great use in our practice, and we find that it really helps patients get over the hump of that dental fear. Now, if you just really, really want to be completely out, you don't want to have any chance of knowing what's going on or remembering anything, and you just really have a lot of anxiety, we do have the option of bringing in an anesthesiologist from a third-party group that we contract with to administer IV sedation before completing your dental work. Again, this is really the best option for those patients with extreme anxiety and just want to be completely out and don't want to even have to think about what's going on.